We all know whenever a patient enter into operation theatre to undergo surgical procedure, there shall be some psychological changes and some physiological changes in patient body. These physiological changes are in form of anxiety, fluctuation in heartbeat, slow breathing, dryness in mouth, or excessive salivation, excessive sweating, pain, feeling of nausea and vomiting, and also several other changes. These all physiological changes are undesirable and should not develop just before surgery or during surgery or after surgery. To avoid these conditions, usually surgeons prescribe pre-anaesthetic medications. These all unwarranted changes can be controlled by using pre-anaesthetic medications. Namaskar, myself Alok Singh. Today I will try to discuss, to clarify this topic, that is pre-anaesthetic medication, in chapter General Anesthetics in subject Pharmacology. Let us start our topic, that is the pre-anaesthetic medications. In previous class, we studied about stages of general anesthesia, and these stages were divided in 4 stages. These are stage 1, stage 2, stage 3 and stage 4. Stages of general anesthesia can also be divided in 3 stages as per clinicians, as per physicians. And these stages are pre-anaesthetic stage, during surgical anesthetic stage, and post-anaesthetic stage. Means the changes that will develop just before surgery, changes in body develop during surgery, and changes in body develop after surgery. Means anesthetic stage, body undergo different physiological changes and psychological changes, and these changes are under category 3, that is the pre-anaesthetic stage, during anesthetic stage and post-anaesthetic stage. Our today's topic is pre-anaesthetic medications that are used in pre-anaesthetic stage. Today we will discuss these pre-anaesthetic medications. Before starting these pre-anaesthetic medications, we will try to understand objectives or aim of pre-anaesthetic medications. Let us start. What are the objectives of pre-anaesthetic medications? These pre-anaesthetic medications are also called adjuncts to general anesthesia. Adjuncts to general anesthesia, it means the drug facilitate surgery and facilitate general anesthetic drugs, or facilitate our body to be ready to undergo surgical procedure during anesthetic conditions. Means these pre-anesthetic medications are aids, AIDS, aids to general anesthesia. These pre-anesthetic medications should be administered 20 minutes to 3 hours before administration of general anesthetics, so that these pre-anesthetic medications develop their effect to avoid unwarranted changes, undesirable changes in patient body just before surgery or during surgery or after surgery, after surgical operations. Now, the first objective of this pre-anesthetic medication is to reduce anxiety and pain in patient body just before administration of general anesthetics or just before going to undergo surgical operations. Means first objective is reduction of anxiety and pain in patient body. Second objective is to control gastrointestinal tract, GIT, to avoid vomiting or nauseating feeling. This is possible by these drugs. These drugs reduce volume of gastric content. These drugs reduce pH, or these drugs maintain gastric pH, and by these two effects, these drugs reduce post-operative nausea and vomiting. Means there are two objectives. Number one is to control or to reduce anxiety and pain, and number two is to reduce post-operative nausea and vomiting. Next is to reduce secretion of exocrine glands. These secretions develop anxiety or affect different parts of the body, different physiological functions of the body. By controlling these exocrine glands, these drugs helps to reduce anxiety and pain in the body. And last is these drugs potentiate hypnotic effect of general anesthetics. Means there are mainly three objectives of these general anesthetic, these pre-anesthetic medications, and these objectives are: number one, reduction in anxiety and pain; number two, reduction in nausea and vomiting; and number three, potentiation of hypnotic effect of general anesthetics. And by this, these drugs help to reduce dose of general anesthetics. And last objective is enhancement of amnesia. Here I am saying word amnesia. Amnesia means loss of memory. Means these drugs will develop loss of memory in patient, so that patient cannot sense or cannot recall the different happenings on his body during the surgical procedures. So these are the main objectives of the pre-anesthetic medications. Now, we will study the name of drugs that are used as pre-anesthetic medications, or name of drug that are used as adjuncts to general anesthetics. And these drugs are analgesics, sedatives, hypnotics, antiemetics, drug that produce amnesia, anticholinergics, and antihistaminics. I am repeating: the category of drugs that are used as pre-anesthetic medications are analgesic, hypnotic, antiemetic, sedative, anticholinergic, and antihistaminics. These drugs help to control different physiological changes in the body just before surgery, during surgery, and after surgery, means after completion of the surgical procedure. First category of drug is analgesic. These drugs helps to reduce dose of anesthetic drugs. Patient feel comfortable just after surgery. He will not feel pain due to different surgical procedure on his body. Usually, opioid analgesics are used as pre-anesthetic medications. These opioids act as analgesics and also reduce anxiety in patients. These opioids have analgesic effect along with sedative effects. Thus, the opioid analgesics are best drug that is used as pre-anesthetic medications. Second analgesic, for example, the opioid drugs that are used as pre-anesthetic medications are morphine and pethidine. Mainly morphine and pethidine are prescribed as pre-anesthetic medications. The second category is sedative or anxiolytic drugs. As name suggests, anxiolytic means drug that kill or that destroy anxiety, and this anxiolytic is also called sedative drugs. Depending upon psychology of patient, anxiolytics are used. Otherwise, opioid analgesic will serve the purpose of analgesic as well as sedatives. Next category is antihistaminics. These antihistaminics are used to control any type of allergic reactions produced by the general anesthetics in human body. And next category is anticholinergics. We have studied three categories. Number one is the analgesics, number two is the sedatives, and number three is the anticholinergics. These anticholinergic drugs prevent excessive secretion of saliva in mouth. If there will be excessive salivation during surgical procedure, that saliva may cause blockage of respiratory tract, and this respiratory tract blockage may cause death of patients. Thus, anticholinergics are also used as pre-anesthetic medication. This drug also cause dryness in mouth. And the next category is antiemetic. Antiemetics, as its name suggests, these drugs are used to prevent nausea and vomiting. Usually, patients suffer from nausea and vomiting after recovery from the general anesthetic influence. These nausea and vomiting will create problem in healing. Thus, these emetics, anti-emetic drugs are used to prevent nausea and vomiting. Example are daporidol or metoclopramide. These drugs help to empty gastric content, and in absence of gastric content there shall be no nausea and vomiting. These are the pre-anesthetic medications. In starting, we studied that stages of anesthesia has been divided into three categories. Number one was the pre-anesthetic stage, and number two is the surgical anesthetic stage. This surgical anesthetic stage is similar as we studied in previous class, that was the stage 3 general anesthetics. And during this stage there shall be loss of consciousness, and these general anesthetics must allow fast induction of anesthesia and fast recovery from the anesthesia. And after that there will be post-surgical stage. In post-surgical stage there will be respiratory depression, and this respiratory depression should be controlled by using proper drugs. If there is pain, in that conditions opioid drugs are used as analgesic, and if there is any vomiting, in that condition anti-emetic drugs are used. But these drugs will not come under category of pre-anesthetic medications.